The number one question all expectant mothers ask and wonder about is, will my baby be healthy? Today's technology allows doctors to detect congenital heart problems early, so treatment can begin immediately. We spoke with Dr. Pierangelo Ranella of Children's Hospital of Orange County, who explains the advantages of early detection of congenital heart disease.
Well, the difference between what a pediatric cardiologist sees and an adult cardiologist sees is that the hearts of these babies don't form correctly. An adult cardiologist will see disease in hearts that are formed correctly. Our patients often have malformed hearts, hearts with holes in them, valves that don't form correctly, parts of the heart that don't grow, parts of the heart that are enlarged.
Dr. Ranella told us how congenital heart problems are diagnosed.
Typically, the obstetrician will identify mothers that are at risk for having a baby with congenital heart disease, whether they are mothers with diabetes or other systemic disease, or whether they have themselves had heart disease in the past, or if the obstetrician notes on their ultrasound that there is a structural defect with the heart, then they'll send them over to me so that I can do a special ultrasound looking at the baby's heart while the baby's still in the mother's womb. And with this technology, I can see the heart moving, I can look at it in different planes and detect exactly what structural disease the baby may have. The optimal window of time to do these examinations are somewhere between 18 and 24 weeks. It's at that time that the baby's big enough that the heart can be seen well, and there's enough fluid around the baby, and all the conditions are right for the best possible imaging.
And we asked Dr. Ranella how prenatal congenital heart disease is treated.
There are a wide variety of congenital heart diseases that can be picked up prenatally. Some of them are fairly minor, like holes, small holes between the two heart chambers, for example. Those may even close on their own without any medication or any surgery. There are several other types, however, that are much more complex and complicated. Those types of defects may require surgery at a few days of life or even 1 or 2 months of life. So fairly early in the baby's course, the baby may be undergoing surgery for some more complex defects. The surgeries done for these complex defects are often done within a few days of life. There are some cases where we can have the baby go home for a couple of months before bringing them back for surgery. For the most part, though, before the baby turns the year of life, we would have done some repair to these more complicated defects.
As you would imagine, there are great advantages to early detection of congenital heart problems.
The most important advantage of fetal echocardiography and the ability to detect these defects before the baby is born is that it really improves the birthing experience quite a bit. Rather than being a surprise, an unpleasant surprise, the family and the doctors involved in the baby's care are aware of what to expect prior to the delivery of the baby, and so the whole experience goes a lot better than it would if we did not detect these problems prenatally.
Dr. Ranella told us about the risk factors for prenatal heart problems.
I would advise that any woman who has either had heart disease as a baby or has diabetes or any other major systemic illness like diabetes, any mother who is expecting a baby that potentially has a syndrome like Down syndrome, any of those scenarios, I would advise that they seek out referral to a fetal cardiologist for a scan. These are some of the indications for a fetal echocardiogram.